Is your practice tired of wrestling with insurance denials, deciphering EOBs, and watching your revenue slip through the cracks? You are not alone. Welcome to The Claim Game, the podcast designed to cut through the confusion and provide you with the best practices for revenue cycle management success. We are Jeremy and Kathryn Zug, and we've been with people just like you in the trenches. Each week, we'll break down complex billing processes, share real-world solutions from practices like yours, and ask questions of the game makers and changers of healthcare so you can take control of your revenue. Let's turn those claim denials into deposits and help you return to focusing on patient care. It's time to win the claim game.
Hey everybody, welcome back to The Claim Game. I'm Jeremy Zug, your host today, and you'll notice that there's not somebody here with me. Kathryn and I welcomed our third child into the world, and so she is currently preoccupied for obvious reasons. So it'll just be me today. And this is the podcast that simplifies the complex landscape of revenue cycle management for busy private practice owners. As a reminder, in this season of The Claim Game, we're going through RCM or revenue cycle management best practices, one board territory at a time. Last time around the table, we finished up the patient registration territory by looking at the key metrics for tracking success. Remember, these are the key territories in the medical billing process, and managing each one is crucial for victory and for your bottom line. We'll be grabbing magnifying glasses to zoom in on each space within these domains, and we will show you the winning strategies to navigate the healthcare landscape with ease and with confidence. This is all part of a sound practice management strategy, ultimately letting you claim victory for your bottom line. Quick reminder, if you missed the initial setup of what the revenue cycle management domains are, we recommend going back to episode 1 for the complete overview. All right, today let's focus our attention on the current territory, which is Eligibility and Benefits Verification. Today we're going to be giving you an overview of this new territory, this new domain. So get ready to analyze its unique challenges and discover the optimal moves to conquer it. So let's get going. Over the last several episodes, we've been really doing a deep dive into patient registration, covering everything from intake to checkout. And today we're going to move on to our third territory on the revenue cycle management game board, if you will, which is eligibility and benefits. So we've talked about getting our player pieces on the board through credentialing. Getting you, the clinician, and your clinicians credentialed is really important. That's all about payer and provider contracting. Getting your clients or your patients on the board through patient registration was the next territory. So now that we have everybody in place where they should be, what's involved in eligibility and benefits? For anyone asking, what is eligibility and benefits in billing? This episode is for you, and we're going to cover why it is crucial before you do anything with a claim. The eligibility and benefits, or E&B territory, is the third step in the revenue cycle management process and a cornerstone of the front-end RCM process. And honestly, this has to happen before there's even mention of a claim. This is a scouting phase, if you will. This is where you do the eligibility check with insurance and verify that the patient's policy is active with an insurance plan that you are in network with. That's the eligibility part of eligibility and benefits. We're checking, is this policy even active? And is there a policy with a plan that I'm in network with? But just as important, we're verifying active insurance policy status and that you can actually see them with their plan. After that, we move to the benefits part of the eligibility and benefits part of this process, the patient benefit verification. And this is where we identify what portion of the bill might be paid by the patient and what portion is paid by the insurance company. This is where we get to the core of understanding patient insurance. What are the benefits given to this patient for the service that you will be providing? And just as importantly, where are they in their benefits cycle? Mastering this particular process, this territory, is all about preventing those costly, frustrating surprises for both you and the patient. This will ensure clear expectations from the very start. The importance of eligibility checks cannot be overstated, because if a patient's benefits aren't understood up front, either by you or the practice or the patient, it's a direct path to claim denials, delayed payments, and very unhappy patients and potentially unhappy clinicians. So yes, you have players on the board, you have clients in play, but can your player piece actually do business with your client? So let's find out through eligibility and benefits. So eligibility and benefits, we're going to walk through the workflow now. This is a complex territory, but again, the good news is that we believe with the right orientation, this is a repeatable process that you can execute every day, the exact same, and will lead to the results that you need. So let's talk about what the workflow looks like. I'm going to walk you through the general workflow from start to finish that a practice should follow for every single patient. You might be shocked to hear that we actually have a workflow for this. It's a 5-step process that repeats and cycles. And our hope is that this makes it easy to follow and not that it's just another list to memorize. So the first step is to organize your payer contacts. This means gathering and, just as importantly, maintaining an insurance contact list for the payers that you're going to call. This includes contact info and every plan that your network with them. The second is to complete the eligibility and benefit check. These are the core E&B check process steps. You verify the patient's eligibility and benefits, including any prior authorization needs or requirements, and those all two important cost-sharing responsibilities between your patient and the insurance company. Step 3 is to communicate to your client, and this is a non-negotiable step. None of it's negotiable, really, but this is really important. You must clearly explain to the patient their financial responsibility before the appointment. This is critical. This is key to avoiding any patient billing surprises. Step 4 is to update accumulations. This is an important step, actually, updating patient accumulations, because they might have a deductible for the service you provide, and your client and the practice should know where they are in meeting that deductible. If they've met the deductible, what is their copay or coinsurance responsibility? And if they've met their out-of-pocket maximum, they may not owe anything. So you have to know where the accumulations are. Step 5 is to repeat. This is not a one-and-done process. People's benefits change all the time. They have unexpected medical circumstances, and it's important to continually update benefits and benefit verification for accuracy and to maintain good patient satisfaction. So the eligibility and benefits check itself. Let's dive a little bit deeper into step 2, which is completing the eligibility and benefit check. If you're wondering how to check patient eligibility, this is the segment for you. What is the real goal of the check, and what's the key information you must absolutely gather? So I'll briefly touch on step 1 again, because organizing payer contacts will make step 2 go much easier. Having the cheat sheet is a lifesaver, and you can get that in the Hourglass Learning Hub found on the Practice Solutions website. So step 2, the primary goal of the eligibility and benefit check is to confirm that a patient is eligible for services with you, the specific provider. Or if they're going to be seeing a different provider, that provider is also in network. And to understand the benefits their plan offers for the services you're providing. This involves checking for things like their deductible, their copay, coinsurance, and out-of-pocket maximum. This is how you determine their financial responsibility. You have to confirm if the plan covers specific CPT codes for the services you provide. Verifying CPT code coverage is a step that a lot of practices miss, and it costs them in denials later. Having a standardized eligibility and benefit check template to organize this information really makes sure that you don't miss any of these details. And the last part is really important. It's not just, are they covered? It's, are they covered for this specific service with me and my practice? That's the level of detail that really wins this part of the game and helps the revenue cycle management process downstream. Step 3, prior authorization. Now, this is This is a sticky and complicated process, and so we're going to walk through this. I mentioned prior authorization as part of the eligibility and benefit check process. This is a term that makes a lot of practice owners shiver.
One of the worst parts of my job, seeing practices lose revenue, not because of bad care, but because their notes didn't back it up. If you're billing insurance, you already know that your notes are your defense. So if your documentation falls short, clawbacks, appeals, and a whole lot of headaches feel inevitable. One of the best parts of my job, empowering our clients to focus on their practice, not payer back and forth. A big part of that has been discovering Blueprint, an AI assistant purpose-built for mental health care. In other words, made by therapists for the way therapists work. I've seen folks start using Blueprint to help with getting progress notes done faster, but it has turned into a game changer. Blueprint drafts compliant treatment plans, visit notes, and flags any missing clinical notes, which means fewer denials, cleaner claims, and faster revenue capture. Check the notes for the link to give Blueprint a try for free.
So what is a prior authorization and why is handling it correctly so critical? We get a lot of these questions about how to get prior authorization. So you can think of this as step 2B, essentially. It's an optional step, but quote unquote optional only in the sense that not every service requires it. A prior authorization is an approval from an insurance company in advance that a service is medically necessary. It's the medical necessity approval. Here's the punchline. Not handling a required prior authorization correctly guarantees a denied claim. And those are incredibly difficult and time-consuming to resolve. So resolving denied claims for lack of authorization is a nightmare. It's an arduous process, and we don't sugarcoat that. So the crucial step is making sure that before you conduct a service, you check the CPT code that you will be providing with your NPI and tax ID and place of service to make sure that a prior authorization is not required. If it is required, you have to add additional steps to make sure you get prior authorization for those processes. Getting that pre-approval is like getting a special key that unlocks payment at the end instead of getting a denied claim. Step 4, the patient conversation. So you've done the check, you know the accumulations, you know the copay and deductible information, you know the prior auth requirements. What about this conversation with your client, with your patient? How do you communicate benefits to a patient? How do we explain all this complex financial jargon clearly and effectively without overwhelming the client? And this is where the next step in the process are really closely linked, communicating to the clients and updating accumulations. This is the core of financial transparency in healthcare. You really need to communicate with the patient in 2 key instances. The first is when you check their benefits and give them the results. So can you see them for the CPT codes that you'll be administering, and is a prior authorization required? And the second is anytime you update their accumulations and something about their eligibility and benefits change, like after checking patient deductible status and finding that they've met it. This is also the part of the process where every office you've ever walked into has a little sign that says, please let us know if anything has changed with your benefits. What the office is asking for there is, do we need to run another eligibility and benefit check so that we can see you and get paid for the service and know what you owe for the service? This communication is the key to preventing billing surprises and building patient trust in your billing process. You have to be transparent about your patient payment responsibility and what they can expect to pay. A benefit summary for patients, even a simple email, can be incredibly helpful. The goal is just to clearly and simply explain their estimated financial responsibility before the appointment. This transparency is a game changer. It shifts the dynamic from, why am I getting this bill, to thank you for letting me know what to expect. It's about being a partner in the care of your patient and not just a provider. All right, so moving on. I'm assuming that you'll need some tools to manage these steps, because building out these steps and making sure that they are repeatable every single time is complicated. And this territory isn't one you just want to navigate from memory for a couple reasons. One, your team sometimes turns over. 2, checking with managed care organizations is complex, and sometimes they change their processes. So let's do a quick overview of the tools for eligibility and verification and your eligibility and benefits workflow. An effective eligibility and benefits workflow really does require a suite of tools. So some practices look for an E&B process automation or RCM software for small practices to help. I'll mention the general tool types, and then I'll tell you a little bit about the tools that we've made to make this process much easier. So first, you'll need a contact list or database to organize all the payer-specific info. We call ours the Insurance Contact Reference List. Again, you can find that in the Hourglass Learning Hub. You can download it. We have a pre-made form that you can plug and play into your private practice, and you don't have to reinvent the wheel. Next, you'll need a template or form to guide the eligibility and benefit check, and a checklist to track things like prior authorizations. We have also made a tool for you found in the Hourglass. It's called the Eligibility and Benefit Check Template. We use it at Practice Solutions for all of the practices we work with. It standardizes what information gets communicated, and it really provides a very nice template for your team to follow. You'll also need a communication tool like some kind of email template for how to explain insurance benefits to patients. We also provide that email template for you in the Hourglass Learning Hub. Sending out a different email per eligibility and benefit check makes the communication feel a little choppy. And if you or your team have a canned email, you can accelerate the amount of communication you can do. And finally, you'll need a dashboard to measure the accuracy and efficiency of your eligibility and benefit process. So like an E&B KPI dashboard helps you identify and fix any bottlenecks or front-end billing errors that are costing you money. So now I want to walk you through a case study of a practice that we actually worked with and found an E&B issue before they worked with us, and then what happened afterward. So for this practice, we were working with a small group practice, and they had a new admin who was a little overwhelmed. And so we came in to relieve some of their time, and they were doing spot checks on benefits to try to maintain this process. So if a patient hadn't been seen in the last 6 months, they just assumed that coverage was the same for some patients, but not others. What happened was a major employer in their town switched plans at the top of the year, and they didn't recheck the benefits for their patients. And for 2 months, they saw dozens and dozens of patients who were now out of network. And this is a classic reason for claim denials, especially as we approach the top of the year. The practice was stuck with well over $20,000 in claims that were either denied or paid at a fraction of the cost, leading to delayed insurance payments. And then they had to have really uncomfortable conversations with their patients about why they suddenly owed hundreds or even thousands of dollars. And it was really hard to recover from that. And we helped standardize this process, and now they know how each patient is covered before they come in. And anytime there's a change, we know about it before the patient is seen so that we avoid en masse uncomfortable conversations. So this highlights why it's important to have a clear process that's run every time a patient comes in the door, and you really repeat that process every time to make sure that you have fewer claim denials and you improve your clean claim rate, as well as the reputational benefit of doing eligibility and benefit checks. I know that putting the responsibility on the practice for doing eligibility and benefit checks can seem like increasing cost. But at the end of the day, what you're really doing is you're reducing your costs by catching issues faster and ensuring that the downstream effect of your revenue cycle management process in your private practice is really clean. So today we covered the eligibility and benefit territory as a whole, and we briefly mentioned all the tools you need to complete the process within this territory. And if you think those would be helpful within your practice, check out the link in the show notes to the Hourglass. We've developed a whole implementation system for running our systems in your private practice, and we really think that benefits you, the practice owner. The next time on the Claim Game, we're really excited to be interviewing a guest game maker. So please come back and listen to that. And we're going to be having robust conversations about this territory during this part of this season on the Claim Game podcast. You won't want to miss it. Thank you so much, and we hope you go out and win your week. If you enjoyed today's episode of The Claim Game, please take a moment to leave us a rating and review wherever you listen to your podcasts. It really helps new listeners to find us. Make sure you never miss an episode by subscribing to The Claim Game on your favorite podcast app. Your feedback means so much to us. We want to provide valuable education about revenue cycle management. So if there's something we didn't cover in our topic that was a burning question for you, please let us know so we can try to get you the information you desire. You can find the links to all resources we mentioned in this episode in the show notes. And if you want to dive deeper into our resources, we have 2 places you can do that. First, you can go to our blog at practicesol.com/blog, where we have 8 years of educational blogs. If you want to learn more about what Practice Solutions does, reach out. We'd love to hear from you. Just go to practicesol.com to learn more and to connect with one of our awesome people on our team. Thanks for listening. We are Jeremy and Kathryn Zug, and this is The Claim Game. See you at the game table next time.